So doctor, when we talk about healthy teeth and gums, gum disease, it's a big problem.
Yeah.
It's a big problem in the US. And I think what we're seeing with dentistry is that somewhere between 3 and 7 out of people walking into most dental offices have some level of gum disease. What is gum disease and what does that mean?
Good, yeah, I'm glad you touched on that. Actually, 70% of the population is walking around with some form of gum disease and they just don't know it because gum disease doesn't hurt, until it gets worse. But there are some signs that can let us know that, this is a problem. So gum disease is basically the destruction of the gum tissue and the bone around the teeth. It's a slow process. But one of the signs is like if you're brushing and flossing and you notice some bleeding. Your gums, if they're healthy, should not bleed. I tell my patients, if you're washing your hands underneath the sink and your hands start to bleed, that would not be normal. Same thing for your gums. If you're brushing your teeth and you notice bleeding, that's not normal. Come see us.
Okay, so bleeding gums is...
Bleeding gums is a sign.
Good. What else would be a sign?
A bad odor, loose teeth. If your teeth look longer than other teeth, these are all signs that there is something going on. So when you come to the office, what we do on all patients is we measure their gums. We use a special instrument. We explain to them what this is for. It's funny because a lot of times patients will tell me they've never had this done before. And so I'm surprised by that. But by those measurements, we kind of know, what if they have gum disease or some form of gum disease and what we need to do to treat that. If we let gum disease progress, slowly your teeth are gonna get loose, you're gonna get infection, they're gonna fall out. We don't want that, Like I said before, people that have teeth live 10 years longer than people that don't, right? You have a better lifestyle, you can eat better, chew better, you have less disease in your body when your teeth are healthy and strong.
Great, so if I've got gum disease, that is producing bacteria and that bacteria is feeding into my body.
Exactly. Yep, that bacteria, every time you eat and swallow, is getting into your body and getting into your bloodstream and can cause a lot of other conditions.
What would be some of those conditions?
Well, diabetes, osteoporosis, Alzheimer's, but mainly the heart, all that stuff can get into the bloodstream, get into the heart. It can cause, possibly heart attacks, strokes, any of those things.
So key takeaway is go see your dentist.
Go see your dentist, exactly.